discovered sleeping sickness? In 1734, the English naval surgeon John Atkins in 1685 to 1757 published the first accurate medical report on African sleeping sickness. Human African trypanosomiasis or sleeping sickness is caused by trypanosome parasites that are transmitted by tsetse flies. HAT is found only in sub-Sahara Africa. Two subspecies of Trypanosoma brucei cause disease, TB gambiense in West and Central Africa and TB rhodesiense in East Africa. Human African trypanosomiasis transmission requires the interactions of humans, tsetse flies, and parasites reservoir. The animal's reservoir is very important in TB rhodesiense and less so in TB gambiense, although it could explain the long-term endemicity in some foci despite of the control interventions. In 1995, about 25,000 cases were detected. 300,000 undetected cases were estimated and 60 million people were estimated to be at risk of HAT infections. In 2001, World Health Organizations launched an initiative to reinforce control and surveillance, and HAT decreased markedly, and ensuring years fewer than 1,000 cases were found. This reduction does not reflect the lack of control efforts, as in general active and passive screening has been maintained at similar levels, around 2.5 million people screened per year.
How many people are infected with sleeping sickness? As the disease progresses, it causes meningoencephalitis and eventually coma and death. Hence, its common name is called sleeping sickness. Human African trypanosomiasis takes three forms depending on the subspecies of the parasites involved. Trypanosoma brucei gambiense is found in 24 countries in West and Central Africa. This form currently accounts for 97% of reported cases of sleeping sickness and causes a chronic infection. A person can be infected for months or even years without a major sign or symptoms of the disease. When more evident symptoms emerge, the patient is often already in an advanced disease stage where the central nervous system is affected. Trypanosoma brucei rhodesiense is found in 13 countries in Eastern and Southern Africa. Nowadays, this form represents under 3% of reported cases and causes an acute infection. First signs and symptoms are observed a few months or weeks after infection. The disease develops rapidly and invades the central nervous system, and only Uganda represents both forms of the disease but in separate zones. Latest data shows that only 663 human cases of sleeping sickness, gambiense form of the disease, were reported in 2022 as compared with 992 in 2019. Active surveillance for gambiense HAT was sustained and 2.8 million people were actively screened in 2019. In 2020, and mainly due to COVID-19 restriction, 1.6 million were screened. This is the classification of Trypanosoma brucei. We have the domain Eucarta, phylum Euglenozoa, class Kinetoplastea, order Trypanosomatidae, family Trypanosomatidae, genus Trypanosoma, species Trypanosoma brucei.
What type of protozoa is trypanosoma? Trypanosomes are unicellular parasitic protozoa belonging to the Trypanosoma genus of the Trypanosomatidae class. Different trypanosome species infect a variety of vertebrates, including animals and humans, and can be transmitted by insects. Characteristics of sleeping sickness. Sleeping sickness is characterized by two stages of illness. In the first stage, infected person typically experience fever, headache, muscle and joint pain, and inflammation of the lymph nodes. The second stage, which develops within several weeks, T. brucei rhodesiense, or within 1, is Trypanosoma a human pathogen? Trypanosomes are protozoan parasites found worldwide, infecting humans and domestic and wild animals, most often transmitted by blood-sucking insects. The typical pathogenic human trypanosomosis are sleeping sickness, or human African trypanosomosis, and the Latin American Chagas disease. What are the signs and symptoms of human African trypanosomiasis? A bite by the chichi fly is often painful and can develop into a red sore, also called a chancre. Fever, severe headaches, irritability, extreme fatigue, swollen lymph nodes, and aching muscles and joints are common symptoms of sleeping sickness. Some people develop a skin rash. Progressive confusion, personality changes, and other neurologic problems occur after infection has invaded the central nervous system. If left untreated, infection becomes worse and death will occur within months. Can the disease be treated? Like most diseases, it is easier to fight African trypanosomiasis if it was diagnosed at the early stage. During that time, medication can be administered easily. Once the disease is treated, you will have to visit your doctor again after 24 months for another checkup to ensure that the parasites did not reproduce the disease once again. The drugs that are used to treat the first stage of this disease are pentamidine and ceramide. Meanwhile, these are the medications that are used by doctors to treat the second stage of the disease: milsarsopol, eflornithine, and niflurtimox. Symptoms usually within 1 to 3 weeks after an infective bite. How can I prevent African trypanosomiasis and prevent other insect bites? First, wear protective clothing, including long-sleeve shirts and pants. The chichi fly can bite through thin fabrics, so clothing should be made of medium-weight material. Second, wear neutral colored clothing. The chichi fly is attracted to bright colors and very dark colors. Third, inspect vehicles for chichi flies before entering. The flies are attracted to moving vehicles. Fourth, avoid bushes. The chichi fly is less active during the hottest period of the day. It rests in bushes but will bite if disturbed. Fifth, use insect repellent. Though insect repellents have not proven effective in preventing chichi fly bites, they are effective in preventing other insects from biting and causing illness.
If you suspect that you have this kind of disease, immediately consult your healthcare provider because they are the one who will provide several tests to look for the parasite. A skin biopsy may be done if you have chancre. Blood test and spinal tap may also be performed. Medical treatment for this disease should begin as soon as possible depending on the result of laboratory tests conducted on the possible infected person. Medical or medicine for the treatment of this disease is available through CDC or the Centers for Disease Control. Hospitalization is usually necessary, and then periodic follow-up exams that include spinal tap are required for 2 years. Sleeping sickness is curable with medicine, but is fatal when left untreated. Unless treated in the early stages of infection, the parasite will invade the central nervous system within the space of few weeks. Death usually occurs within several months. And only 4 drugs are available for the chemotherapy of human African trypanosomiasis. These are ceramide, pentamidine, milsarsopol, and eflornithine. But there is what we call fixinidazole. It is an oral treatment for Gambiense human African trypanosomiasis. In the year 2019, it was included in the World Health Organization Essential Medicines list and World Health Organization Human African Trypanosomiasis Treatment Guidelines. These molecules is listed as first line for first stage and non-severe second stage. Reminder, there is no test of cure for human African trypanosomiasis. After treatment, patients are closely followed for 24 months and monitored for a relapse. Recurrence of symptoms will require examination of body fluids, including CSF, to detect the presence of trypanosomes. To all of you who are watching this video, we would like to recommend that if you are bitten by a tsetse fly or you have the symptoms of this disease, please seek immediate medical attention because if this remains untreated, human African trypanosomiasis may lead to a coma or even death.